Every resident in a long-term care facility needs some degree of help in providing for their own care. This applies to cleaning of the mouth as well as other areas of need. Thorough and efficient toothbrushing and denture care are complex tasks that require a great deal of mobility and stability. We cannot assume that because a resident is able to perform most activities of daily living, that he can also keep his mouth clean. A care provider is responsible for the clean, healthy mouth of every resident. The mouth is the gateway to the body. It is a barometer of total health, and its condition will contribute to the general health of your residents. In this presentation, we will discuss the impact of oral health on total wellness. We will also consider daily mouth care for residents with no teeth, those with teeth, and those with dentures. Each segment will include oral care considerations for the conscious resident, uncooperative resident, bedridden, and comatose resident, and each of their special needs. We all know that proper oral hygiene helps prevent common oral conditions such as bad breath, tooth decay, gum disease, and tooth loss. But what may be less obvious are the effects oral hygiene has on overall wellness. Let's take a look at some diseases and conditions that may be linked to oral health. We will start with cardiovascular disease, or diseases that affect the heart or blood vessels. Several of these conditions may be linked to oral health. It is thought that bacteria from gum disease can enter the bloodstream and travel to the heart, affecting the cardiovascular system. These bacteria could be associated with clogged arteries that may eventually cause a heart attack or stroke. The bacteria may also cause inflammation of the heart lining and arteries, which could be fatal. Diseases of the lungs may also be impacted by poor oral health or oral bacteria. Research suggests that bacteria in the mouth can be inhaled into the lungs. Some studies have shown that these bacteria are capable of causing some lung conditions, including pneumonia, the number one killer of long-term care residents, or worsening of some chronic conditions like COPD, emphysema, and bronchitis. Active oral infections, such as periodontal disease, can also have adverse effects on persons with diabetes. The infection in the mouth may cause blood sugar levels to increase and become hard to control. Likewise, diabetes may contribute to periodontal disease, as it takes longer for the gums to heal. Additionally, diabetes increases the risk of cavities, tooth loss, dry mouth, and many oral infections. Conditions in the mouth resulting from poor oral health, such as missing teeth or painful teeth and gums, can be factors in malnutrition and poor digestion and nutrient absorption. Poor oral health may also alter the ability to speak clearly, cause emotional distress and embarrassment, and alter one's self-image. Now that you know more about the importance of oral health, we will show you what you can do to maintain the oral health of the residents in your care. First, the edentulous resident, or one without teeth. The purpose of mouth care here is to remove food debris and bacteria, to massage gums and improve circulation, and to promote general good health. The supplies you will need for your resident without teeth are a soft bristle toothbrush, water, towel, possibly a mouth prop, and a curved basin. This procedure should be performed daily, following breakfast and before bed. Wash your hands before and after all oral hygiene procedures. Wear gloves to prevent contact with oral fluids. Your resident's position may vary depending on his condition. If he is in a wheelchair and able to perform this task with your supervision, positioning may be at the bathroom sink. If the resident is bedridden, you will have the head slightly raised or turned to the side, and use a curved basin for any rinsing. Before beginning, always explain to the resident what you will be doing.
All right, Ruth, I'm going to brush your teeth this morning.
First, Wet the toothbrush with water and massage the gums and tongue with gentle circular strokes. Rinse the mouth with water and have the resident empty his mouth. If the resident is comatose, combative, or has swallowing defects, do not put any liquids or toothpaste in the mouth. Brush with a dampened toothbrush and wipe debris from the dampened toothbrush onto gauze or a washcloth. Rinse the toothbrush and wrap it loosely in a paper towel to air dry. Oral hygiene aids may also be stored in a curved basin or in a cup with toothbrush bristles facing up. Keep all oral hygiene supplies together and in an area where they are not readily available to other residents who may use them by mistake. All oral hygiene aids should be labeled with the resident's name using a permanent marker. After returning the dental supplies, remove soiled gloves and wash your hands thoroughly. 60% of seniors age 65 and older have some or all of their natural teeth. We will now take a look at oral care for these residents. The purpose of this procedure is to remove food debris and bacterial plaque, to massage the gums, to promote healthy gums and teeth, and to promote general good health. The supplies you will need are a soft bristle toothbrush, toothpaste, a curved basin, water, towel, mouth prop, and cup. It is very important to thoroughly clean the teeth and massage the gums twice daily. Any additional brushing can only improve oral health and prevent problems. Position the resident at the sink or in his wheelchair or bed, depending on his condition. Explain what you are about to do. Again, wash your hands and put on gloves. Wet the toothbrush with water and apply a small amount of toothpaste to the brush. Remember, if the resident is uncooperative, comatose, or has a swallowing defect, you will omit the use of toothpaste and any liquids, and simply use a dampened toothbrush and wipe it onto a washcloth or gauze to remove debris. Although toothpaste has many added benefits, it is not necessary for thorough cleaning of the teeth. The mechanical action of the toothbrush itself removes the plaque and therefore helps prevent gum disease and decay. If the resident is seated in a wheelchair, you will work from behind and cradle the resident's head in your arm. Cup your hand under his chin and put your thumb inside the lower lip to retract it. This is called the head cradling technique, and it allows for good visibility, control, and support. This method will allow you to clean anyone's mouth, even that of a combative person. You may need a partner to handhold in some cases. Always remember that throughout the cleaning, you should never place your fingers between the resident's teeth. If the resident is bedridden, you can adapt this technique, or you can work from the front if the resident is cooperative. You may need a mouth prop to perform oral hygiene for your comatose or uncooperative patient. There are many types of mouth props available for use. They vary in size, shape, and price. Mouth props can also be made with items that you have on hand, like a dampened washcloth or gauze wrapped around a tongue blade. Management in your facility should determine the best prop to use. It is important to remember that mouth props are generally considered a form of restraint and require special written permission for use. If you are allowed to use a prop, insert one end of the prop into the side of the mouth. If the resident will not open his mouth, you should place your thumb inside the lower lip. Apply downward pressure as you gently rock the lower jaw back and forth. The mouth will open, and with your free hand you may insert the edge of your prop. After brushing one side of the mouth, apply slight downward pressure and move your prop to the opposite side of the mouth. It's important that you hold one end of the prop at all times. Begin brushing the lower teeth in the front center area. Angle the toothbrush bristles slightly toward the gum line and use a gentle circular motion with the bristles overlapping the gum line to clean the teeth. Continue to brush all surfaces of all teeth. Develop a sequence so that you do not forget an area. The tongue side of the back molars is the hardest to reach, so leave those until last, as brushing here may cause some gagging or resistance. Also, brush the resident's tongue to remove bacteria and food debris. If the resident is conscious, cooperative, and has no swallowing defect, you may then have him rinse his mouth with water, and have him empty his mouth in a sink or basin. Rinse the toothbrush and store it properly with other oral hygiene aids. Remove soiled gloves and wash your hands thoroughly. Red, bleeding gums generally result from bacteria. You can improve the gum health greatly by brushing thoroughly and emphasizing the gum line. Bleeding and redness should decrease over time with proper brushing. If the resident can brush his own teeth, let him do it, but supervise and be sure he has thoroughly cleaned every tooth surface. Show him how to massage the gums with the bristles. Adapt a toothbrush for residents who might be able to brush their own teeth, but have difficulty due to limited use of their hands. Here are examples of adaptive aids that you can order or make. Comatose and semi-comatose residents must have clean mouths also. Good oral hygiene can prevent aspiration of bacteria and food debris that can cause serious complications. Remember, do not use toothpaste, rinses, or any type of liquid for these residents. Simply dampen the toothbrush, brush the teeth, and wipe debris on a washcloth. Now we will look at oral care for residents with complete or partial dentures. Care should be provided twice daily, morning and night. The purpose of these procedures is to remove plaque and food debris from the denture and the mouth, to massage the gums and improve circulation, and to promote general good health. The supplies you will need include a soft bristled toothbrush, curved basin, water, towel, mouth prop, cup, denture brush, denture cup, and denture cleanser. The denture cup and brushes should be labeled like the other supplies with a permanent marker. Before removing the dentures or partials for cleaning, it is safest to add a towel and water to the sink in order to protect the denture as you clean it. After washing your hands and putting on gloves, position the resident and have him remove his dentures if he can. Occasionally, upper dentures may be hard to remove. If the patient cannot do it, you must remove the tight upper denture yourself. Ask the resident to puff out his cheeks to loosen the seal. If that doesn't work, place pressure downward with a finger positioned on the back border of the denture on the cheek side. The lower denture will usually come out very readily. Be sure you have a paper towel ready when you remove the dentures. To remove a partial denture, apply pressure with your fingernail under each metal clasp resting on the natural teeth. You may need the patient or a family member to show you how the first time. Rinse food debris from the denture using warm water. Then, scrub the denture with a denture brush and toothpaste or mild soap. Clean the inside surfaces of the denture as well as the outside surfaces. This is critical to the health of the mouth tissues that the denture rests on. Brush the metal clasp on a partial denture. Remove all food debris and sticky plaque. Rinse the denture thoroughly. Brush the gums, tongue, and any teeth in the mouth with a regular toothbrush each time you brush the dentures. Rinse thoroughly, only if the resident's condition permits. Soak the denture in water at night or for at least 1 hour in the morning for residents who cannot tolerate leaving their denture out at night. Occasionally, the denture should be soaked in a denture cleanser in order to remove stains. Never use bleach or harsh abrasives for cleaning the denture, as they could damage the denture or fade the color. Rinse the denture thoroughly after cleansing and before putting it back in the mouth to avoid irritation from the denture cleanser. Whenever the denture is not in the resident's mouth, it should be soaking in clean water in the labeled denture cup. In addition to brushing the denture twice daily, rinse the denture and mouth after every meal. When you are sure the mouth has been properly cleaned, return the partial or denture to the resident's mouth. Clean and replace all oral hygiene supplies. Remove soiled gloves and wash your hands thoroughly. Here's an example of a dirty denture. Notice how much cleaner it is after brushing and soaking. Here are some special hints and reminders. Red, irritated palates can be caused by a dirty denture. Clean the denture well and you might cure the problem. It is important that you look for ulcers, white patches, unusual bumps, lumps, sore spots, or bleeding. These could be signs of problems such as cancer, yeast infection, or trauma. If a resident complains of any of these symptoms, check it out with a flashlight and then report anything unusual to your supervisor. Make sure that all dentures are marked with the resident's name. If the name has faded, report it to your supervisor. Also, report any ill-fitting, loose, or broken dentures, or those that are left in the drawer because they hurt. If you note an extremely dry mouth, report it as well. Dry mouth is a very common condition for seniors. It can result from medications or disease. Dry mouth can range in severity and may cause painful sores, difficulty speaking, and alter the taste of foods. A review of medications may be needed and a saliva substitute might be prescribed. Remember, if a resident can clean his own denture and mouth, let him do it, but supervise and inspect the mouth and denture frequently. Every resident is unique and may require modifications when providing oral care. Adapting the procedures that were demonstrated in this video to the unique needs of your resident is crucial to gaining resident acceptance. Include the resident in the decision-making process when planning for oral care. Find out the resident's likes and dislikes. If available, and approved by the resident and his dentist and physician, offer mouthwash, fluoride, and anti-plaque rinses to the daily routine to combat decay and gum disease. Mouthwash with alcohol should be avoided as it is drying to mouth tissues. Make sure residents have all the oral hygiene supplies they need to properly clean their mouths daily. Discard worn-out brushes and replace them with new ones, and mark all supplies with the resident's name. Additionally, you should discourage the constant use of candy, cough drops, and soda with sugar that can cause decay. Plaque removal every day for every resident is an important part of your job as a care provider. Unless a resident proves that they can thoroughly clean their mouth every day, you must do it for them, or at least supervise their daily oral hygiene. A clean mouth is an important part of total body health. It promotes a positive self-image and the feeling of well-being that we all seek. Take the time to give your residents the best care you can give by adding oral hygiene to your daily routine.